So thank you everybody for joining us today. We've got an excellent presentation for you. Before we get started, just a couple quick housekeeping items. If you do have any questions during today's presentation, please submit those using either the chat or Q&A function. You can find those by hovering either at the bottom or top of the screen, depending on which view mode you're in. We will try to moderate those as the presentation goes along. If you have a verbal question you would like to ask, we ask that you hold that until the end. We will be able to unmute lines at that time, and you can raise your hand at that time for us to unmute you. Again, you find that raise hand function by hovering either at the top or bottom of the screen. We are recording today's session, so if you can't join us for the whole time, we will have it posted to our YouTube channel later this afternoon. And we will also be sharing a couple resources that Jeff has given us today, along with our very quick 60-second survey link, where we ask you to give us a little bit of feedback on today's Lunch and Learn and your ability to access it. Promise it takes 60 seconds or less, so we appreciate everybody's feedback. So without further ado, I will go ahead and turn it over to Jeff Harper.
Thank you, Ally. Good morning, or good noon, as it is in Indiana. I'm speaking to you from Louisiana. I am with InQuiseek Consulting. We are an RHC consulting group that we're out of Louisiana, but we work in multiple states, including Indiana. In fact, there are many clinics in the state of Indiana that have our compliance software and our subscription system for our policies. So with no further ado, let's get into what we're talking about today, and that is the RHC vaccination confidence grant. This grant is being provided by HRSA, and I want to thank HRSA. I'm using many of their information here so that we make sure that we cover everything. And to be honest with you, I'm not a grant writer, but I was a CPA for many years auditing governmental entities that had grants. So I'm somewhat familiar with the grant process. And I also want to thank the Indiana Rural Health Association for giving me this opportunity. So with no further ado, let's go into this program. They came out with a notice of funding opportunity May 26th. So it's not been out long, but the other issue is it's not going to be around that long. The application due date is June 23rd. So that we basically have about 20 days to get this thing accomplished. And let me explain. This is not a grant like mini grants. Mini grants, it's competitive, and you have to you're awarded based on your presentation. Well, fortunately for us, we're not in that competition. If we can give them a complete application, we will be granted the grant. And so that's great. As you can see on the left-hand side of your screen, that is the NO4, which is the Notice of Funding Opportunity. It's 28 pages, and you can get it from HRSA.gov. And it's going to give all the description and most everything that I'm going to communicate in some form or fashion. It addresses those things. To summarize, this grant is for all qualified RHCs, and it's anticipated that the grant will be for $50,000. However, if there are more people or less people, that number can change, and I will explain what we must do based on that. As I said earlier, the application's due the 23rd. They suggest that we get it actually in on the 20th, so that doesn't leave us much time. The program goes from July 1 to June 30th. It's a one-year program of which we have to plan, budget, and execute during that period of time. Most of the applications they suggest are going to be about 10 pages long, but they do not excuse me, if you have a 20-page application and I only have a 5-page application, if mine's completed 5 pages, you're at no advantage by having 20 pages. So as succinctly as we can do this, the better. The purpose of the funding, I think, in case you don't know, we're finding all over the nation, but especially in the rural areas, that there is a lack of confidence in the vaccine and what it will accomplish for us. Recently, I had an RHC nurse practitioner tell me that right about the time she was given the vaccination, the patient looked up to her and said, "Are you sure you're not implanting a microchip in my arm?" And it's those kinds of theories that are going around that the federal government wants us to try to help combat these things. And so this is primarily for education of COVID-19 and the vaccine and what it can do and what kinds of vaccines are available and where you can get them, and dispelling any of the notions that there's something else going on here. It also can be used to help promote other vaccinations such as pneumococcal and flu. And so it's a wide range of vaccination education that's available to us. Since RHCs have never participated in grant programs, the FQHCs have for many years, but RHC, this is about the first grant that's been offered to RHCs. And so just so that you understand, a grant is just a way for the government to give you funding to do certain things. And in our case, it's to help educate our community. And so they're giving us these funds. Okay, a summary of the funding. It's going to be $50,000 per RHC, which means that if you are a provider-based RHC owned by a hospital, if you have 3 RHCs, then you're applying for $150,000. It's pretty simple. The number of valid RHCs that you have multiplied times 50,000 is the amount that you're asking for. You only need to do one application for the tax ID number. So for example, if they don't want separate applications, if a hospital owns 2 clinics, they don't want 2 applications. They want one application with both CCN numbers. So that's just to let you know, they don't want duplicate applications. So if you make one application for as many RHCs as you own. And who's eligible? It's all Medicare certified RHCs. Now that's the terminology that HRSA uses. I don't think there's any other kind of RHC than a Medicare certified. But in case there is a new terminology. But I want you to know that if you are a pediatric clinic, this statement does not restrict. You can still apply for these funds, even if you have never filed a Medicare claim based on your patient population. But that does not matter. If you're a valid RHC, you can apply for this. And now that we know that there are adolescents that can have this vaccine, it even is more imperative that the pediatric clinics apply. You apply whether you're profit or nonprofit. You apply using your one tax ID number or employer identification number, plus all your CCN numbers that correlate to your RHC. And once again, I've reiterated, one application, even if you have multiple RHCs in your organization. Additional considerations, you might have heard such things as a cost sharing or a matching grant. Well, this is neither. You don't have to put any funds into this. You don't have to match this. That's not required. However, the application to get these funds is June 23rd at 11:59, and that's 11:59 p.m. Eastern Daylight Savings Time. And so, and I would suggest that you do it earlier than that. But, and once again, if you send in an application and it's wrong and you send in another one, they're going to go with the last application you sent in. How to apply? It's a 3-step process. You've got to get a DUNS number, you've got to get a SAMS number, and then you have to register with grants.gov. And the reason why I say start now is because to get the DUNS number, if you don't already have one, if your hospital doesn't already have one, or you as a clinic doesn't have one, that DUNS number takes 1 or 2 days. And then the SAMS number takes up to 10 days itself. So we can be behind the 8 ball on this thing if we don't start now. And none of these numbers or registrations cost you any money. And in fact, if someone tells you to send money, that's not required. That if someone's telling you that, it's probably someone that is trying to aid in the process and wants you to pay them to help write this grant. But I don't think it's necessary. So if there's some place that says we got to send money, you should be concerned that you're not dealing with HRSA. You're dealing with some other organization. As far as the Dun & Bradstreet number, the way you go about doing that is you go to fedgov.dnb.com, and you'll want to do this. You want to have one DUNS number for your whole organization. You do not want a DUNS number for each clinic. You want a DUNS number for the one organization. And many of you know, because you've had to deal with this, many of you have a legal name of the clinic that's normally not disclosed, and you have a DBA name of the clinic that is disclosed. It's what's on the wall. Well, for your DUN number, you do not want to use your DBA. You want to use your legal name. And in fact, they're going to ask for more documentation when you apply for your DUN number. They're going to ask you to upload some documents to prove your legal name and your ID number. And so, and as you can see on this screen, on this DUN bracket, you go to start now if you don't have a DUNS number. And then if you're already registered, you can go to the next start now, which is when if you already have your number. All right, the SAMS number. Once again, you go to sam.gov. You must have your DUNS number in order to get your SAM number. And so, and once again, you either get started, or if you're existing, you renew that entity, which means that you update it. Once again, this is all free, but this takes 7 to 10 days after registering and after submitting a notarized letter to SAM. So it's going to take a while. So I suggest that you start immediately in that process. Now, the data that you key in and register in SAMS, some of that data is transferred over to grant.gov automatically, so that you will have your own login already there for grants.gov if you've properly entered that information into SAM. And once you get into .gov, you can modify and add to your profile to add where other people can be involved. Once you get to grants.gov, you log in, then you click on Get Registered Now, and you fill out the registration. And at that point, you will be given updates if there's any updates being sent out for the grant that you're acquiring. Once we get there, and you can get this off of the NOFO, or you can go to the HRSA website and get this. There are various pages. We've got to deal with a project abstract, a project narrative, a budget narrative, and any other attachments. And that's why they say its suggested length is 10 to 15 pages. And like I said, it doesn't matter. They're not going for volume here. So let's get into some of the details. To do the project abstract, what that is that's just a high level summary of who you are and what you're going to do. It's not difficult. It doesn't need to be, but it could be just a short paragraph. But what's got to have in it is the funding opportunity number, which is 21142. That's HRSA 21-142. We got to have the CFDA number, which is 93.912 on your abstract. You got to have the name of the organization that's submitting the grant. And then you've got to have the name of the clinic and the name of the project, which in our case would be if it's one clinic, it would be the clinic name, Vaccine Confidence Project. Or if it's an organization like a hospital, it would be that hospital Vaccine Confidence Project. And then once you have the abstract, you got to have the names of the RHCs and a brief description of what you plan to do. I have, this is something that's available to you. We have already written an abstract for your use. Is what you would do is you would come in here and put your legal and DBA name, your DBA name plus the Vaccine Confidence Project, the name of the RHCs that are included in this, and then here is the actual short description of what you plan on doing with the funds and what you're trying to do. This abstract is available to you from the Indiana Rural Health Association. We have it in Word so that it'd be easy for you to modify. And then after you've modified it, it has to be uploaded. Also, you have to do what's called a project narrative. And all a project narrative is basically what we're going to do, how we're going to do it, the detailed plans of that, and some organizational information. Now, let me just tell you, if you're sitting there saying, well, I don't even know this program that well, how am I going to budget and come out with a worked out plan? Well, it's pretty simple. You're going to be trying to educate people in your community. That could be word of mouth. That could be with flyers. That could be with billboards. That could be with signage on the side of the building. That could be public service announcements on the radio or on TV. There's many varieties of doing that. We could call meetings and have town hall meetings across our communities. We could go to the Rotary Club and the Lions Club and the Kiwanis Club speaking on the vaccination confidence. There's many ways that we can use the funds. And they do not expect you to have this all figured out. In fact, they are quite sure at HRSA that whatever you say you're going to do, it's going to get twisted and modified depending on what happens. For example, you might find that the main thing, you can't get people together to talk to them about it because they don't have transportation. So part of your plan would be to lease a vehicle that we can go around, or a van that we can haul people to the clinic so we can educate them. Various things that you can do with the funds. And I'm sure we'll have some questions to address that. On that project narrative, you want to use some of the same language that you used in the abstract, but there's also some other things that you must do. Let me explain this. We're applying for $50,000. But if not many RHCs apply, it might be all the way up to $200,000. It's going to be somewhere in that neighborhood. So that means that you might be applying for 50 and you could get 100. And you go, well, wait a minute, I didn't budget for 100. Well, here's what you have to do. In your narrative, your project narrative, in the first section, which is on methodology, if you put this statement, my RHC is willing and able to accept increased funding for the Rural Health Clinic Vaccine Confidence Program. Now, if you do not have that statement in there, you're going to get $50,000 and that's it. But if you put that statement in the methodology, in the project narrative, you will, if there's excess funding, you will get that. And so here's how HRSA is going to do that. HRSA is hoping that enough people will apply that everybody gets 50,000. But if, let's say, their estimate is half, or the actual is half of what their estimate is, well, that means every clinic that applied could get up to $100,000 if they have this statement in their plan. So that means that when these applications come in, HRSA is going to make a giant chart. It's going to have your tax ID number, it's going to have your CCN number, and it's going to have a place on their chart that says can accept more funds. And when they're finished, they're going to determine how many people can take more funds and how many people did not say that they could. And they're going to send all those that didn't say 50,000. They're going to take the rest of the funds and divide it by those people that could take the additional funds. So with that being said, I suggest you have that sentence in your project narrative. Obviously, if you don't want to get more than 50,000, that's fine. But there are many things you can use this for. So I would consider that. You do not, however, if we put that sentence, that does not change our budget amount. We do not have to budget. They don't want us to budget more than 50,000. So even though you might get 100, you don't have to budget for 50. Now, at the end of the program, we have to show an accounting of what we've spent the funds on to justify that we spent them on the purpose and nature of this grant, which was to build confidence in the community on vaccination and on testing. And so that's what this is all about. So I suggest that you put that in your narrative. Now, I have written a methodology sample, which this too is available from the Indiana Rural Health Association, that you would put the name of your RHC and you would come down here and communicate with them as to what's going on and how you're going, what you're going to do with the funds. And then the second page of that is the workflow, which is communicating the fact that we have a specifically what we're going to do. And all of this is pretty much boilerplate, because I think every RHC is going to participate in public meetings, forums, and school assemblies and whatever. And they're probably going to pay their staff to be at these things, which when they pay their staff to be at these things, that can come out of the funds. And so we're also going to use clinic resources to administer the vaccines and in other non-RHC settings, which means maybe after work or somewhere else. And then we're going to use all types of multimedia, social media, advertising, and marketing. So this work plan pretty much covers everything that you need to deal with. And then the last thing that they wanted on this narrative was organizational information, which you're supposed to give who the project director is, the name of the RHC, the address of the RHC, the county that it's in, its EIN number, and its CCN number. These are things that talk about verifying that you qualify. And so this has to be in your, what's called your project narrative. And that eligibility requirement, if you remembered, I said it, the name, address, county, EIN, and CCN number. Well, if you have multiple clinics, they would suggest that you do it like this, which you can get this spreadsheet from the HRSA website. In fact, if you've got multiple RHCs, this is what you would use. Okay, in addition to the application, you got to do 2 budgets. One budget is basically the number budget, and one budget is a narrative budget. Now, I'm from Louisiana. We're not accustomed to 2 kinds of budgets, but really all they're really asking for is each budget item, tell us what it is and what you're going to use it for. And so you just describe what that is. And then you get the numbers to all add up. And there is a limitation that you can't include salaries if there's any one person that's getting more than $199,000. And so there is a limit there for how we can spend the money on salaries. But once again, if I've got 3 RHCs, I'm budgeting 150. If I've got 5, I'm budgeting 250,000. But if I just have 1, I'm budgeting 50,000. And then on this budget narrative, this is just how you're going to use the funds during that period of time. And the time frame for these funds is July 1st to June 30th of 2022. However, if we've spent money before the grant is given to us on the very things that we included in our presentation or in our narrative, then we can go back all the way to March 15th. So let me give you an example. If I'm going to do a public service announcement saying that vaccines are safe, they'll help our community, they will get our economy going, and they've been tested, and the FDA has approved the use, and here's where you can get those. If y'all did a public service announcement, and let's say it cost you $4,000, and it says, and this is brought to you by the ABC Rural Health Clinic. If you did that in April, then since that is the exact thing that they wanted you to do, then you could retro back to March 15th any expenses that you had that complied with what you're trying to do with the grant money. So the grant actually goes from July to June. We got to spend the money and do what we need to do with it in that period of time. But we actually have where we can go back a little ways for about a quarter, if indeed we had those valid expenses. So with that being said, the budget narrative is basically every item that's in the budget. I just need to explain what we're going to do with it. And here are the budget narrative categories: personnel, fringe benefits, travel, equipment, contractual, supplies, other direct charges, and indirect charges. You can see an example of this in the NOFO, and of which that's the notice of funding opportunity. And you can see examples of that, but this is nothing, guys, this is not rocket science. However, you've got to recognize that if you are going to acquire equipment, and let's say that we were going to buy a van to go to certain areas and set up education centers. And we did that. And let's say it cost $8,000, it would go under the equipment section. However, if we're going to use that van to do something else, like do house calls for E&M visits, then we would have to allocate how much of the van is used for education pertaining to the grant and how much of it is used in our normal clinic operations. So for example, if it was an $8,000 van, which I don't know where you can buy an $8,000 van, but I'm using that for my illustrations. If half the time I'm using it for the clinic, just as transportation, either of patients, or we're going out on site to do nursing homes to do E&M visits or encounters. If that's the case, we can only have 4,000. We can only have 4,000 put on our budget because half of it is not pertaining to this vaccine confidence grant. So anything that you put in here, they expect it to be used fully for that purpose. And if it's not fully using that purpose, we can only budget and spend the portion that goes to that purpose. Okay. If we look at the application and all the components, which all of this is on the HRSA website, you can see all these things. These are the things that they won't complete in the grant application that is submitted electronically. They want the application, the project narrative, the abstract. They want us to make an attestation that we're not doing any lobbying. They want a sheet that has key connections or contacts, and the budget. They want all that to be submitted. Let's talk a little bit about the award. The award is going to take place sometime in mid-July. And like I said, you should not be concerned that you're not going to get it. If you apply and fill out the paperwork properly, you will be awarded. So even though we're not going to get the funding until mid-July and notice of award for it, the spending actually is the window of July 1st to June 30th. HRSA wants you to follow the SF 424 application guide. But to be honest with you guys, if you're not writing grants, this is just the format that grants need to be under. And if you're not going to do that on a regular basis, I don't know how much value looking at the SF 424 guide is, but it's here. On page 14 of the NOFO, it discusses what our reporting requirements are. And the great thing is this is not going to be a monthly or a quarterly reporting like some of the other things that we've done. This is going to be at the end of the year. We're going to have to, no later than October, give a performance and closeout report, which shows how we spent the money, how much money we spent, and to show that it fell into the categories we said it was going to fall into. So we're not going to constantly be having to do a whole lot of reporting. Okay, here's some reminders. I'd go out there and look at the NOFO. I would go to the Dunn and the SAM and the grants and get all that taken care of as quickly as possible. I'd review everything that you had and try to get this in by June 20th. They would like you to do it 3 days ahead of time. You know, knowing our government and knowing what happens with emails and everything else, I think they're wanting to spread it out so that we don't have everything coming in on the last day. Okay, the application checklist. This is called Appendix C in the NOFO so that you can go there and look at it. But it's just saying, have I read everything? Are we eligible? Have we done the things that we're supposed to do? Does my application total to $50,000? You know, you just got to go through here and check to make sure you've got it all done. And so that is the gist of how to apply. Now, there are some other issues and other questions, I'm sure, but the simplicity of it is go to Done, go to Sam, register on grants.gov, get the packet, fill out the packet. The only real heavy lifting you're going to have to do is a project narrative, which I have an example of one that is a Word document that we can give you. You got to do an abstract. We've got that done. You got to do a budget, both a budget and a narrative of that budget, which is, at this point, they know that you probably are somewhat guessing on what's going to take place, because none of you have gone out and priced how much is a public service announcement. None of us know if the school system or the county authorities want to go in on more communication, which we're going to partner with them. So we don't know those things. So everything could change. What we have to do is come up with saying, okay, I'm going to pay people more to work harder, meaning they're going to do it after hours. They're going to go to faraway places to communicate. So I'm going to be paying people more. I'm going to be buying some equipment and other things to do this education like it needs to be done. I might buy projectors that I can, put on a brick wall to show people what we know. I might be making flyers and printing stuff out. There is a lot of different ways. I might hire someone full-time just to go around through the county or my service area, which I can. And so, but at the same time, at this point in time, we have only known about this grant for about a month, and it only came out when we could apply for it on the 26th of May, and we're only allowed till the 23rd of June to get it in. So they don't expect us to have a budget that's correct. They want us to have a budget that's reasonable. And that's a subjective notion, but based on all indications, they're not going to grade us. If it adds up to 50,000 and it's things that sound reasonable now, you can't be buying a boat to do vaccine confidence education. You just can't, I don't see how a boat works. Even in Louisiana, we travel a lot by boat, but I don't see that that's what we can do. But other than that, reasonable things can be put in the budget and you're going to get the grant. And once you get the grant, then you got to figure out, okay, I've got $50,000, let's say. What's the best way to educate people? And as a byproduct of that, all the advertising that you do can be branded with our logo, our clinic name. This is all brought to you by the ABC RHC in your county seat or whatever. Or if you have any further questions, contact the ABC clinic on Main Street. So it does a great job of advertising. And right now, when we're struggling to get our numbers back up after COVID, this is a great way to make a great impact on our community. Here's my contact information. If you've got any questions, you can call or email. And man, I made it through in 40 minutes. So do we have any questions?
Jeff, excellent presentation. We did have one question come in. Is this for education purposes only? Are there any limitations on what you can spend the money on, such as incentives?
Now, I'm assuming when you say incentives, you're talking about if someone comes in to get a vaccine, you're going to give them a pen and a lollipop or something else. I'm sure that we could work something in those kinds of incentives, but it is primarily to build confidence within the community that the vaccine and the vaccine programs are valid. Now, and it's not just for COVID. I can use these for flu season. When it starts, flu season will take place during this grant, and I can use it for flu vaccination education and building confidence in those vaccinations also.
Okay, if there's any clarification on incentives, you can go ahead and type that in. But that's the only question that I had submitted so far. If anybody would like to ask their question verbally, you can use the raise hand function at the bottom or top of the screen. You just hover your mouse and some options will pop up or down, and we can unmute your line. Or if anybody wants to submit any more questions through the chat or Q&A, you are welcome to do that at this time as well. And I will be sending out an email by the end of the day with the attachments that Jeff referenced, the PDF of today's slides, as well as the 2 Word docs, a link to the recording of today's session. And also, if everybody could just quickly check the chat, I am sending out our survey link. Promise you it will take less than 60 seconds to fill out, and it is really important for us to collect this data to be able to continue having free programs like this one. So we appreciate everybody filling that out.
Well, and in addition to that, I have some questions that have been asked in other states. And so let me go ahead and answer a couple of those. Is, you know, can we purchase equipment, like I said earlier, and can I purchase a van for transportation? Absolutely. But if I'm going to use it other than during this window, I need to only put the portion of the van that I feel like realistically goes along with the education. So in other words, if I'm going to the nursing homes and seeing patients, that's normal clinic activity. But if I'm only doing that half the time, that means half the purchase price of that van can be paid for with this HRSA grant, which also means that when the funding is over with, that we still have the van. And many of you have done this before with telemedicine equipment, is that a grant will come and you can buy telemedicine equipment during the grant. Well, when the grant's over, you still got the telemedicine equipment. And so the other thing is you can partner with other facilities and other governmental agencies in conjunction with this education. You can also, as far as a hospital that has multiples needs to budget for $50,000 per each clinic, but you can do it in the form of one. You know, you can pool the resources together and say, okay, we've got 150. How are we going to spend it? It doesn't have to be tied to each one of your RHCs. It just means that if I got 3, I got 150,000. How am I going to spend my 150,000? The other question that's been asked is what happens if I'm surveyed and I've been accredited? So I have an effective date before June 23rd, but I don't have a CCN number. Well, I contacted HRSA today and they said that if you do not have a CCN number, you're not going to be a qualified applicant. So I'm sorry to say that to some of the people that are trying. I don't know if I was in your same position and I was trying to get certified, I don't know if I wouldn't go ahead and do that, even though HRSA says they're not funding that. I think that at some point, if someone went back to HRSA and said, hey, you had more funds than you needed. These are valid RHCs. They just haven't gotten their CCN number yet. And so I don't know if I wouldn't, quote, gamble and try, but that's what HRSA said. I believe that's the only questions I have from other states.
Thank you for that, Jeff. And we haven't had any more questions come in through the chat or Q&A. Once again, if you do want to verbally ask a question, now is your chance. Go ahead and use that raise hand function. You could also just say in chat, I have a question. I can also unmute you that way. But I think we're probably going to wrap up for today. Appreciate everyone's time, especially Jeff for the excellent information. Again, we have recorded this and we'll post it to our YouTube channel shortly. Everyone that registered today will receive the link and the materials that Jeff has provided. So thank you everyone for attending.
Thank y'all.